If you're over 60, there's a hidden health danger that few people notice: the risk of stroke during sleep. This risk doesn't come from smoking, unhealthy eating, or lack of exercise, but from something seemingly harmless: taking vitamins incorrectly. Millions of older adults believe that daily vitamin supplements are the best way to maintain strong bones, good memory, and higher energy levels. But the alarming truth is, some vitamins, if taken in the wrong dosage or at the wrong time, especially at night, can silently harm the brain's blood vessels and increase the risk of stroke without any warning signs. Neurologists have documented numerous cases of stroke in elderly patients that aren't linked to traditional risk factors like high blood pressure, diabetes, or cholesterol. Instead, these strokes were caused by toxic buildup from vitamins D, E, B6A, or niacin. These vitamins, when overdosed or taken inappropriately with medications, can lead to high calcium levels in the blood, brain hemorrhage, nerve damage, or increased intracranial pressure. What makes this more dangerous is that the process happens silently and without pain. A person may go to bed feeling healthy, but could wake up paralyzed on one side, slurring words, losing balance, or worse, never wake up again. That's why older adults must reevaluate their vitamin habits. More is not always better. What matters is taking the right type, at the right dose, and at the right time to truly protect brain health and ensure safety during sleep. Vitamin D has long been considered a friend to bone, immune, and mental health. However, few realize that when used incorrectly, especially at high doses in the wrong time, it can become a silent enemy to cardiovascular and brain health, especially for those over 60. Many seniors take daily vitamin D supplements to prevent osteoporosis or support immunity. Some even take 5,000 IU or 10,000 IU daily, far more than needed, and consume it at night, thinking it will absorb better during rest. But this is a serious mistake. Regularly taking high doses of vitamin D, particularly at night, can lead to excess calcium in the blood, as vitamin D increases calcium absorption from the gut. This surplus calcium can build up not just in the kidneys but also in the blood vessel walls, making arteries stiffer and narrower. An especially dangerous situation for older adults with already weakened cardiovascular systems. The result is a higher risk of blood clots, and if these clots travel to the brain, they can cause a stroke, often occurring during the night or early morning when blood pressure fluctuates and blood thickens due to overnight dehydration. The frightening part is that this process is silent, with no obvious symptoms, causing people to go to bed feeling fine, but wake up with paralysis, speech loss, or worse, not waking at all. Therefore, if you're taking vitamin D, carefully check your dosage. It should not exceed 2,000 IU a day without medical advice, and always take it in the morning instead of at night. Don't let a well-meaning habit turn into a hidden life-threatening risk. Vitamin E is widely known as a powerful antioxidant, beneficial for the heart, skin, and memory. As a result, many older adults trust it as a daily supplement to preserve health and slow aging. However, few know that high doses, especially over 800 IU daily, combined with blood-thinning medications like warfarin, aspirin, or Plavix, can lead to a dangerous outcome: brain hemorrhage. In clinical settings, neurologists have reported numerous cases of elderly patients suffering strokes from brain bleeding, not due to hypertension or trauma, but because their blood had become too thin. High-dose vitamin E acts as a natural anticoagulant, slowing blood clotting. For those already on blood thinners, adding high-dose vitamin E makes the blood excessively thin, making the fragile brain vessels more prone to rupture, particularly in the elderly. Worse, the early symptoms of brain hemorrhage, headache, dizziness, nausea, are often mistaken for common ailments, delaying emergency care. By the time speech slurring, confusion, or partial paralysis occurs, the damage may be irreversible, leading to permanent memory loss, weakness, or even death. What's concerning is that the daily vitamin E requirement for seniors is only about 15 milligrams, 22 IU, but many supplements on the market contain 400 to 1,000 IU per capsule, often without clear warnings. So if you're taking vitamin E, especially with heart or blood-thinning meds, consult your doctor. Don't let a beneficial vitamin silently damage your brain. Vitamin B6 is often promoted as a miracle nutrient for the nervous system, said to improve memory, energy, and reduce numbness in seniors. It's common to see supplements labeled brain support, circulation booster, or nerve stabilizer, containing high amounts of B6. Yet few realize that taking high doses, especially 100 milligrams or more daily, for extended periods, can cause severe nerve damage, often irreversible. Vitamin B6 plays a role in neurotransmission and energy metabolism. But in excess, it can damage the myelin sheath, the protective layer around nerves, similar to insulation on electrical wires. When this sheath is harmed, nerve signals become inefficient, leading to numbness, tingling, loss of sensation, imbalance, difficulty walking, shaking hands, or confusion. The danger lies in how gradually and silently these symptoms appear. They're often mistaken for aging, joint issues, or dementia. Many don't realize that the very vitamin they believe is making them healthier is in fact slowly damaging their nervous system. The recommended B6 intake for older adults is just 210 milligrams daily, including from food. However, many supplements contain 50, 100, even 200 milligrams per pill. Daily use over months or years can overload the system, causing chronic nerve damage. If you're using brain, nerve, or energy support products, check the label immediately. Don't let ignorance force you into using a cane or losing mental sharpness because of a single supplement. Vitamin A is long recognized as essential for vision, immunity, and skin health. To slow aging and protect their eyes, many older adults take vitamin A supplements or products for eye health, skin care, and immune boosting. However, high doses, 10,000 IU per day or more, taken long-term without medical supervision, can cause serious brain damage. Unlike water-soluble vitamins like C or B, vitamin A is fat-soluble, meaning excess amounts aren't flushed out via urine, but are stored in the liver, fat tissue, and even brain tissue. Over time, this buildup can lead to a condition called pseudotumor cerebri, dangerous pressure inside the skull that mimics stroke symptoms. Symptoms include persistent headaches, blurry vision, dizziness, nausea, speech slurring, and memory loss, easily confused with stroke or dementia, especially in seniors. If undetected, prolonged high pressure can damage the optic nerves, leading to permanent vision loss. What's troubling is that the recommended daily intake for older adults is only 2,500, 3,000 IU, while many anti-aging eye and skin supplements contain 5,000 to 10,000 IU per capsule. Combining multiple products can easily push intake beyond safe levels without users knowing it. So, if you're taking vitamin A from pills or multifunctional products, check your total daily dosage. With vitamin A, more is not better. Overaccumulation can cost you your brain and vision. Niacin, or vitamin B3, is an essential nutrient often used to lower cholesterol, improve circulation, and boost energy. Many seniors, especially those with heart conditions, are advised to take niacin as a natural alternative to medication. But at doses over 50 milligrams per day, niacin can trigger dangerous side effects, especially for heart and brain health. A hallmark reaction to high-dose niacin is sudden vessel dilation, causing facial flushing, skin redness, or rapid heartbeat. But soon after, the vessels constrict, causing erratic blood pressure swings, sometimes high, sometimes low. These fluctuations place stress on the heart and brain vessels and may result in temporary brain ischemia, TIA, or mini-stroke, an early warning sign of a future full-blown stroke. In older adults whose vessels are already less elastic and who may be dehydrated or on blood pressure meds, these fluctuations are even riskier. Symptoms may include dizziness, speech slurring, temporary imbalance, headache, or faint fatigue that soon resolves, leading many to ignore them. Additionally, many niacin products on the market today contain 500 to 1,000 milligrams per dose, dozens of times the actual need of 14 to 16 milligrams per day from food, and a max of 50 milligrams per day under medical guidance. If you're using heart support or cholesterol-lowering supplements with niacin, check the label carefully. Don't dismiss flushing, dizziness, or brief headaches. They may signal your vessels are under strain. Niacin can help, but only if used correctly. Misuse could cost your brain's well-being. One reason vitamin supplementation becomes riskier with age is because metabolism and accumulation patterns change over time. Fat-soluble vitamins like A, D, and E tend to build up in the body because they're not excreted through urine like water-soluble ones. Instead, they're stored in the liver, fat tissue, and even nervous tissue, raising the risk of toxicity if taken long-term without monitoring. Meanwhile, even water-soluble B vitamins can become harmful at high doses over time, like B6 damaging nerves. In older adults, liver and kidney function, critical for metabolizing and eliminating excess vitamins, often declines, making it harder to process surpluses effectively. Other factors like chronic medications, poor diet, or weak digestion also affect how nutrients are absorbed and processed. This makes self-prescribing high-dose vitamins without blood testing or medical supervision a serious risk. Instead of mindlessly taking vitamins, seniors should understand each one's properties, follow proper dosages and timing, and prioritize nutrient intake from whole foods to minimize harmful buildup. To use vitamins safely and effectively, especially for those over 60, it's crucial to regularly check blood markers like vitamin D levels, calcium, and liver/kidney function. Supplementation should always be guided by a doctor, not based on personal judgment or advertising. Timing also matters. Most vitamins, especially fat-soluble ones like A, D, and E, should be taken in the morning after meals to reduce accumulation during rest at night, when detoxification and circulation slow down. Elderly individuals should review their supplement cabinets, eliminate unnecessary or overlapping products, and avoid high doses. Rather than more is better, aim for balance, appropriate need, and natural sources to protect health sustainably. Instead of relying entirely on synthetic vitamins, seniors should prioritize nutrients from natural foods, more bioavailable, balanced, and safer for the body. Whole foods not only nourish the brain and heart, but also support immunity, digestion, bones, and long-term energy. Leafy greens like spinach, kale, water spinach, and bok choy offer folate, vitamin K, antioxidants, and fiber that protect blood vessels, reduce inflammation, and support cognition. Fatty fish like salmon, sardines, and mackerel are rich in omega-3s, essential fats that protect nerve cells, lower stroke risk, and boost memory. Seniors should eat fish 2-3 times weekly. Berries like blueberries, raspberries, and strawberries are loaded with polyphenols and antioxidants that fight inflammation and slow brain aging. Nuts, walnuts, almonds, flax seeds, chia, and whole grains like oats, brown rice, and whole wheat bread provide vitamin E, magnesium, fiber, and steady energy, ideal for older adults. Lastly, don't forget proper hydration. It boosts circulation, detoxification, and ensures water-soluble vitamins work effectively. By choosing the right foods, you can protect your brain and body naturally without needing synthetic pills. After age 60, every health choice becomes more critical. Taking vitamins isn't wrong, but it must be informed and controlled. Many believe vitamins are always good, yet don't realize that misuse or overuse can harm the brain, heart, and body, sometimes irreversibly. The key is understand both the benefits and hidden dangers of each vitamin. What works for young people may not suit older adults, whose absorption, metabolism, and elimination capacities change. Taking high doses without medical advice, consuming them at improper times, or mixing them unsafely with chronic meds can turn a good habit into a hidden danger. Rather than relying on pills, seniors should prioritize real foods. Simple, natural, nutrient-rich choices like leafy greens, fatty fish, seeds, whole grains, fresh fruits, and water. This is the safer, wiser, and more sustainable way to nourish the brain, enhance health, and maintain long-term clarity. Ultimately, accurate awareness is the best medicine. When you know what your body truly needs and doesn't, you'll make smarter decisions to protect your brain, heart, and quality of life. Lasting health doesn't come from a bottle, but from knowledge, mindfulness, and conscious choices every day.